One of the reasons why I'm so passionate about El Paso is I really believe the people of El Pasoans should not have to travel to the Mayo Clinic in Scottsdale or MD Anderson in Houston or anywhere to get top-notch medical care. That's one of the big reasons why I really felt strongly about returning to El Paso. Some of my patients have been my kindergarten teacher, Ms. Omohandro, who still remembers me, and my basketball coaches from high school and junior high have been my patients, and people who helped form you are now your patients, and to me there's really nothing better than that. And so the ability to do that and to bring my medical expertise and my compassion and my manner of taking care of people to El Paso has been awesome. I'm always striving to try to stay on the cutting edge as best I can. Since I've been in El Paso, of course, I've continued to essentially do mini fellowships and train all over the country in different areas, and that's how I learned about the MAKOplasty and the blue belt technology, as well as direct anterior approach to the hip. The benefits of the MAKOplasty and the blue belt technology is, first of all, we are with regards to the knee, we have the ability to tailor the surgery to the specific needs of your knee. The knee joint can be divided into 3 different compartments, and a traditional surgeon would say we need to replace all compartments. If one of the compartments is worn out and it's bone on bone, then we need to essentially throw the whole knee away. And I compare that to remodeling your house, and if you want your bathroom redone, you tear the whole house down and rebuild the house. I think most people would think that's crazy, and I think likewise with the knee, sometimes that's just too much. If you just have one compartment that's bone on bone, then we can address that and we can save the rest of the knee. Minimally invasive, it's less invasive. You haven't burned as many bridges. You know, once you do a total knee replacement, you can never go back. With a partial knee replacement, you haven't burned those bridges, and there's still some more that you can do if necessary later. Minimal blood loss, less pain, less swelling, less propensity to have post-operative complications such as blood clots and many of the things that come with a larger surgery. The fact that you can have it as an outpatient procedure and go home potentially the same day, or virtually most of my patients go home the very next day. Less time in the hospital, less opportunity to get a hospital-acquired infection. These are all great benefits that are associated with the MAKOplasty and the blue belt technology. Direct anterior approach to the hip allows us to get into the hip probably the least traumatic way possible. Direct anterior approach combined with the MAKOplasty is about the latest and greatest cutting-edge technology that you can get right now. Anything that involves the shoulder, we're very proficient at, so arthroscopic, labral repairs and rotator cuff repairs, sports injuries, work injuries, any sort of fracture. And then on the arthritis side, we do total shoulder replacements and reverse total shoulder replacements, which are 2 very unique treatments for arthritis of the shoulder. There's very few doctors in the El Paso area who are doing the direct anterior approach, even fewer doctors doing the Mako hip. And as far as I know, there's nobody doing both except for me. So that puts me in a unique category to be able to offer both at the same time. Hip arthroscopy is a very, very hot burgeoning area in orthopedics, and it's something that, again, I've taken lots of time to go learn on cadavers and learn in courses, and we've done probably about 50 hip arthroscopies in the last year or so. We usually do at least 1 to 2 seminars a month about knee pain or hip pain or different orthopedic issues, where patients can just come into a relaxed, patients or prospective patients or just lay people can come into a relaxed environment, ask an orthopedic surgeon really any question they want. I don't limit the questions. We talk about anything they want as far as medicine, and really have an open communication, answer their questions, try to allay some of their fears, and it's really enjoyable. It's usually a very engaging thing, and we usually have to just cut it off because they'll keep, I could stay there all night answering questions. So it's something I enjoy doing, and we try to do it on a regular basis. I definitely enjoy teaching the next generation of doctors kind of my philosophy and how I believe medicine should be done. And so I'm always open to students rotating through my clinic, taking them to the hospital with me and doing what I can, medical students, residents, even pre-med students. So that's another passion of mine.